Good morning, everyone, and welcome to our webinar today. This is our Adult Engagement Dissemination Learning Project Consultation webinar. We had one in March, and this is our webinar, consultation webinar in April. I am joined today with Yvette Kelly and Ruth Cullen-Wagner. Jason Jones he regrets that he's not able to participate today. So we have some slides to review with you, and we wanted to just really get a sense of what you need and where you are in the process. As a reminder, today's consultation webinar is for our learning community participants. So if you're not a learning community participant, can you just chat in with us so we can get a sense of who you are and to make sure that you want to still participate today, because tomorrow we also have the same webinar, but it is for those people who are not in the learning community. So if you are also all have the ability to just talk with us because there are very few attendees, and we want to make sure that you can get the most out of the webinar today. So if you're not in the learning community, can you just chat in with us or talk with us about that? Is everyone a part of our learning community, the Adult Engagement Dissemination Project learning community? You want to chat in yes?
Yes.
Yeah? Everyone is? That's great. Good. Good. Some of your names I don't recognize, and some of the names say call-in user, so I just want to confirm. Okay, so we're going to go on. Everyone is unmuted, so please mute yourself. Can you please mute yourself until you talk, so that way there's no feedback for others to be able to hear everything? That would be really great. Thank you. So my name is Cara Dina Sale. Like I said, I'm joined with Yvette Kelly and Ruth Cullen-Wagner, and we've been part of this project from its inception, so we're excited to be here with you and be with you throughout this process. Today we're just going to review a few important things, importance of engagement, supervision as an engagement tool, the engagement process and best practices, just very briefly. You all know this. We just wanted to have kind of a quick review with you. We're going to talk about some common challenges. We have a few vignettes for you, and then we're going to check in on your progress. We wanted to start by really getting a sense of if you've been able to use any of our practices or resources that we've been talking about throughout our time together. What exactly have you used, and then have you noticed any changes since utilizing the engagement practices and resources? So if you want to chat in or just talk with us, that would be awesome. I'm going to just show you all of the things as a review of what we've given you. So these are our guidelines. So we have guidelines for the initial contact, the first meeting, and then we have for ongoing contact. We have a brochure that Ruth created for everyone in the hopes that this was something that you could utilize in the very first contact. We have our elements of engagement handout with also a checklist for supervision. And we have our session feedback form. Have you been able to use any of these, and have they been helpful? Who wants to speak up?
I've used the session feedback form.
Great. And who is this?
This is Kathy Rundle, Family Services.
Hi, Kathy. Welcome.
Hi.
And so have you been using this consistently? Did you use it before, or is this something that you just started using? Can you talk a little bit about that?
Well, what I did first was to try to get an idea of how many people we screen not admit, because I thought that was important to have. But then we've been handing this out. I don't have the numbers I want back yet. We have started it. I have checked a few of them, but I need more in order to see how helpful it's been. I will say that I'm thinking that just asking the questions of people, I'm getting a sense they feel more listened to and heard.
Yeah. Wonderful. That's just so great to hear. Yeah, you know, it doesn't have to be a formal process. We've talked about that before. It could be very informal. You know, what did you think about today's session? Did we cover everything that you wanted to? Are we reaching your goals together? So an informal process is just as helpful. But that's great. So your idea is to collect them and kind of review them with everyone?
Well, what I've been doing is collecting, going back and looking to see if it's made a difference with engagement. And then as I get this done, we'll be talking more about it in both management and his teams. But I need enough feedback at this point to, from people to kind of follow that pattern. And that's kind of what I thought would be helpful for us, because we do have a fair number of screen not admits for whatever reason.
Sure, that's great. I would love to hear if you find that it is helpful, that it is contributing to more engagement. That's a really great thing to begin to really look at and investigate. So thank you. Anyone else? I see that Carrie's trying to call in. I think Brianna's trying to help you, Carrie. Anybody else? Are you using any of the resources that we've created for you, or any specific practices that have made a difference for you? We'd love to hear about that.
Yeah, hi, this is Joseph Lavecchio from ConCOR. How are you?
Yeah, good.
We've actually implemented those plastic cards that you gave out at the meetings we had. We've implemented those, especially for our intake staff, and we've done an in-service on how to speak to people, how to answer the phone when somebody first calls. That's been very helpful. Also, we've, in order to help with the retention, the intake staff and quality assurance staff has been assisting clinicians in making calls and outreach to clients to make sure they know their appointments, either be with the psychiatrist or with the therapist. All the patients for psychiatric services get called the day before. However, the therapist sometimes has difficulty getting in touch with the clients, and so our staff, our intake staff, is assisted in that matter, and it's helped to get people to come in. Other than that, just other things by having clinicians make their schedules available so that we know if there's free space in the schedule, and we have an intake that they can do the intake with somebody. And we haven't implemented any feedback surveys for the patients. However, we do periodic satisfaction surveys with the clients.
Okay, great. Thank you. That's wonderful to hear that you're implementing call reminders, and you're also really implementing the initial phone contact guidelines.
I think it's great. I was just going to say that I think it's so great that you did an in-service for the staff. It's just wonderful, because sometimes when we just hand them things, it's not priority, but when you bring people together and say, this is really important, we need to pay attention to engagement, and then, of course, providing the guidelines. I'm very happy you did that.
Yeah, I should mention, I forgot, I meant to mention it, Ruth. We had two in-services from I forget what your colleague's name. I'm sorry, just went blank with him. Cultural competency and trauma-informed care that we invited the entire agency to do, and that was very helpful.
You're in New York City, right?
Yes.
Yes, so that's Larry Hockwald.
Yeah, that's right, Larry, I'm sorry. Yeah.
Larry's a great trainer. I'm so glad that he was there and did that for you guys.
Yeah, no, it was very, very good.
Good, thank you. Great feedback.
Hi, it's Carrie. Hi, Carrie, welcome.
Oh,
hi. Good, I was able to get on.
Great.
We have all staff that are participating in this project, where we've all identified a new patient who's come into the clinic to facilitate, engagement and how they're using, because for the February webinars, we had all staff attend them and watch the webinars to be able to get the skills from the webinars. We continuously use supervision as to follow-up as to how are you engaging the clients. So one of the things specifically that I even work with staff is, the nonverbal cues that we're given regarding engagement for when clients are missing appointments. How are you addressing that missed appointment? Are you calling them once and that's it? Are you discussing with them about their psych evals, when they miss a doctor or they attend a psychiatric? Because that's all part of engagement, because you're showing the connection to their care and that you're following all their appointments, not just the appointments they have with you. And also, are you connecting the prior session with the next session? What was followed up in the previous session, are you discussing that in the next session? Because sometimes, use of the rope, to make sure that you're continuing to follow continuity of care, because when a client comes in, if you're not following from the previous session and you're starting off on something new, the client's not going to really feel connected.
Right.
Or that you're following their care or working towards the goals. I really like the session feedback form. I think it was a great form. I think it's a great tool that I'm encouraging our staff to be using, because I think it's important to get the feedback from the client. It's a way, kind of goes with rope, to kind of summarize a little bit of how the session went and how they felt they were walking away with that day, because sometimes therapist perceptions are completely different than the client.
Right.
Or participant.
Yeah. Right. Yeah. And we know the research tells us that as well.
Because sometimes what a therapist thinks, they think that, what the most beneficial part was an area they focused in on. Meanwhile, it was a 2-minute part of the session that, the individual thought was the best part of the session.
Right.
So
Great.
we just made a. Go ahead. We're trying to make sure that we connect it all. Go ahead, Kara, sorry.
No, that's fine. I was just going to say the same thing. It sounds like you've made a lot of changes, very slight changes, but that it seems to be making a difference so far. What did you think about your colleague who is going to look at the session feedback form and kind of attach it to attendance and kind of assess that? Is that something that you're interested in doing, or is that?
Because like I said. No, I really want them, because one of them, some of the staff, sometimes when you're handing them, and this is a part of, like, as management, how are you engaging your, supervisees to, come on board with this? Because it is a different way of providing care that maybe some people aren't used to using. So getting them on board with using the session feedback form, I think, like I said, I feel it's a great tool. So I am trying to utilize it. I have one particular case where I've been working with this particular supervisee and like giving them all the steps as to how they're losing engagement, because part of they didn't schedule for the doctor visit, and I'm like, you got to identify the importance of the follow-up. By you not scheduling, you're not stressing the importance of the evaluation. You're presenting that, their participation is, oh, okay, you're here. So we've been working on, because even the child, it's an adolescent, the parent involvement is, minimal, and that's what's coming through. So it's how do we catch the parent to have, because the child, once they're here, they're engaged, they like being here, they really want to be here, but it's the parent who's saying, well, he's doing fine. So it's really how to engage that parent and help that parent to engage in the care.
Right. And Carrie, how have you found that your supervisees, how do you find that they are utilizing this information, or do they find it helpful, or do they, tell me a little bit about that. How do you integrate that into supervision and help them in terms of developing these engagement skills?
I can speak directly with the staff I directly supervise. I mean, I can say that it doesn't all go with everybody. I would say maybe you get like a 50% that's really, feeling good about, because, I had all staff attend the webinars, and you could see, because I summarized how the webinars were helpful and useful, because sometimes what the staff feels like, we know this. And it's like, no, sometimes we feel we know this, but we're not putting it in practice.
Right.
Like it sounds familiar, but we're not putting it into practice. So that's what I was trying to help staff to really recognize from the webinars is, this all sounds familiar, but it's about putting it into practice.
Okay.
So sometimes when you have like seasoned clinicians, it's hard to, it's a cultural change, for them and how they're providing care. So some of, it all depends on how open your staff is to developing difference and change. But I can say the 2 staff that I'm directly supervising are very open to the feedback and very open to what I'm providing them with.
Great. Great.
Yeah, this is just excellent. Thank you so much for sharing, Carrie. I think it's really admirable, all of the various steps that you're doing to really try to change the engagement practices. And I really appreciate you saying, with seasoned clinicians, it's a real kind of mind shift and that you've been working with, and that's not always easy. So I appreciate you really sharing that.
Because one of the things with most of our, and I'm sure other agencies experience it, I mean, majority of the reasons you close out cases is because non-attendance, you know, or, you know, the clients aren't following up or they're not coming back. I mean, that's the majority of the reason for cases being closed. So really important to, you know, and that's where, you know, you help the staff to really understand where is the client at, or participant, I know you guys don't like client, find out where the participant is at and, you know, work with them at the level they're at and engage them into the care and understand what progression is in care and how we're meeting those goals and when do we stop coming and when do we stop attending. And I know for our clinic, we actually developed an orientation group, you know, for all new clients that come into the agency. We've now developed a 3-session orientation group to orient them into the program.
Wonderful. Is that new, or is that something you've done for a while?
Yes, new. No, it's something that, out of this, we developed it out of attending.
That's wonderful.
Realizing that,
is it helping?
Yeah. I think that's an excellent idea, just in terms of, like we said, it seems like most people would know what therapy is, but really people, participants don't necessarily know what they're committing to. So I think that's a great way to really start the engagement process and really work with them in determining whether or not this is a good step for them. So it also speaks to giving them choice and voice, and so I think that's just terrific.
Yeah, because we want we want participants to understand what clinic services are and, you know, understanding what we offer here as, you know, not just the individual, but groups, and understanding groups and understanding like referrals to support systems and what those support systems are, and, you know, how do we provide family involvement. So it's really an educational about clinic services, about resources, and how to have family involvement.
And do you mind if I ask, do you use the brochure as part of those sessions?
You know, to be honest, no. And I'm, you know, thinking about it, that might be something that could be helpful.
Well, it reminds me that it seems like you brought the brochure to life with these orientation sessions, which I think is wonderful, but I wanted to see if you also had kind of a takeaway as well for people. And is it like a 1 session? Is it 3 sessions? I'm asking because I'm thinking that others on the line may have the same kind of questions. And how do you bill for it?
We bill it as a group, you know, and it's really about, you know, understanding symptoms, understanding treatments, and, you know, what the services are. It's a 3-session group. We also discuss hospitalizations. If you go into the hospital, what does that mean if you go into the hospital, how to communicate with the hospital, signing consents and having that care be coordinated. So it's really providing them all information and understanding, you know, how they're here and how program's going to help with their symptoms. So real orientation, that's so helpful and so important, because I think often when people come in for services, they're not necessarily wanting to sometimes, or they feel like they've done everything else and they don't know what else to do. And so having relieving that anxiety and all those questions from the very beginning, I think, makes a huge difference. And it seems like you found the same thing. No, and the participants who have attended the groups are providing great feedback. They're like, this is so helpful. I didn't know this was available. I didn't know that was available. These are great services. So they're really finding out, again, how do you handle an emergency? When you're in a crisis, who do you call? You know, when the clinic is closed, who do you contact? When your therapist is off, who do you contact? So it's all those things being incorporated in. If you're going to miss an appointment, who do you contact?
Wonderful. And did you create the curriculum on your own or collaboratively? Or did you
it was collaboratively with me. It was collaboratively with me, between me and the therapist who's running the group, and taking a lot of this information here. You know, I said some of, like, coming to the meetings, you know, expanded the thought process as to want to expand this into something more developed, more formal, versus just, you know, having one therapist discuss all the services.
That is just wonderful. I love it. Well, I don't know if you'd be willing to share it with others, but I know that others could benefit from it. would you be willing to do that, or you don't have to?
I
mean, or you could like stamp your organization's name on it so that everybody knows it comes from you. You could think about it, but it sounds like it could be really helpful for others as well.
Mhm. Well, we're also, because as we're doing this, I mean, as we're doing it also, we're tweaking it, so it's kind of, it's still in the development, because as things come up or as the participants provide us with more information that they want, like they're giving us information on what's missing. So we're still developing it to make it really be a true curriculum, so it's kind of a work in progress.
Yeah, sure. You're still piloting. Okay, well, keep us posted on that. That's wonderful. I love it.
Okay.
Thank you. Anybody have any questions for Carrie, or any other thoughts, or anything you want to share around your use of any of the resources?
You know, this is Ruth. I just wanted to make a comment on something, Carrie, you said earlier that really, really resonated with me. When you talked about, clinicians closing cases, and the majority of the reason they're closing their cases is because people are not showing up. And I mean, that just speaks to people not really being engaged. And historically, especially with the medical model and people not being person-centered, I'm talking years ago, especially those seasoned social workers, we go into this thinking it's them, it's them, it's them. And it's really us. It's all of us together. And, so looking at my portion and my responsibilities towards helping that person to really get engaged, coming from a strengths-based perspective. And I just think it's great that you guys are having your staff be involved in the webinars from the beginning. It really does show that this is a critical item that we're all paying attention to.
Thanks, Ruth. Yeah, I second that. Absolutely. So we're going to move on, but please feel free to chat with us or talk with us throughout. We're going to also have, we're just going to do a brief review again and then check in with you around any way that we can help you as you move forward, any barriers you've experienced, and look at a few vignettes. So, Yvette, do you want to just review the importance of participant engagement?
Sure. So talking about the importance of participant engagement, I just want to remind folks that this learning community is really taking a look at how we as supervisors can support the learning of engagement for our supervisees, and what are some of the skills and strategies. And again, we spoke about this as a review. A lot of you have put a lot of this into practice. And really kind of getting some good feedback around it. But what we want to keep in mind is that participant engagement begins really at the onset of when someone walks in the door, right? And so there's multiple levels that are all involved in the engagement. So as Carrie had mentioned, or I believe someone else had mentioned in terms of sharing some of those engagement guidelines, that's really key, because the participant-therapist relationship is going to be really important. And so we want to kind of remind ourselves of that. Successful participant engagement practices can contribute to successful participant recovery, right? So in order to get them to keep coming in so that they can meet some of their treatment goals, they need to be engaged. Increased rates of attending initial face-to-face appointments. And I know for everyone, this is kind of like the big banger. In terms of, the no-show rates and really trying to reduce no-show rates, and how do you do that? And then engagement is one of the best ways to really mitigate your no-show rates. And it also can lead to increased rates of follow-up appointments. And again, you want folks to keep coming back, to keep getting the services that they need so that they can meet their goal areas. And we know that supervisors are crucial in promoting engagement practices. And also, just in terms of role modeling and moving forward. So again, there's a whole continuum of people that are essential in the engagement process for individuals coming in, get front desk staff, therapists, if you have any other auxiliary staff. So we really want to be mindful of that, and we want to role model the engagement strategies so that it really is a community of engagement for participants coming into clinics. All right, we're going to move on to the next slide. So some helpful coaching and mentoring. Again, just some review. The coaching and mentoring process begins before the intervention or service is provided. So when you have staff, you're really working with them day one in the door, discussing kind of the importance around engagement. You're discussing with them their service plans and any concerns around strategies or difficult clients that may be a challenge to them. You discuss how your supervisor will approach the work, right? What's their, how are they going to approach working with a particular client or a particular group of clients? You want to provide helpful tips based on engagement and best practices, so a lot of the things that we've just spoken about. And for practices with fidelity, you want to review the fidelity indicators and identify which indicators will be the focus of work. And I want to say that if you have a new hire coming in, that you want to, I think, start the conversation off around how important engagement is, and that may be one of their indicators in which you're kind of looking at to determine how well they're doing. I think letting them know that up front is very helpful. And for direct observation, you want to discuss and how the supervisor will be introduced. We spoke about this in prior webinars, the need to have direct observation of your supervisees on some schedule so that you can provide feedback in terms of how they're doing and really help them kind of navigate any problem areas that they may have. You always want to give the supervisee the first opportunity to reflect on the work. So, ask them what do they think is going well, what are some of the things that they're struggling with. You want to focus on their strengths and how you can utilize their strengths to help them overcome some of their difficult areas. You want to share feedback in a way that doesn't necessarily establish the supervisor as the final expert on effective practice, right? You want to be share feedback in terms of what you see they can improve upon, how they can improve upon it, and then also let them offer some, their perceptions about, and their kind of perception in terms of what they're working on and how well they think things are progressing for them. You always want to offer concrete suggestions that are practical and can be applied at the next available opportunity. And that's why CTAC really likes handing out some really concrete resources that you can use literally when you get off the phone at the next, at the next time a supervisee sees a client, because they're really practical and you can apply them immediately. And you want to get feedback from your supervisor about the helpfulness of coaching. So the same way that you want to elicit feedback from participants working with therapists, it's the same concept in terms of the supervisor. So what do you like about our supervision? What do you think could be going better? And you want that to really open up the lines of communication so both of you can grow and learn. All right. And I think next we're going to go to the elements of engagement, which is Ruth.
Okay, thank you so much. And we know that we presented this slide to you in the past, but one of the things that we strongly believe in is that, to give you as many resources as possible, and that repetition in the learning process would really help us to increase our competency. And so this is a pictorial representation of the elements of engagement. And so we all learn differently, and I love pictures, I love graphs, and so this, for me, as a clinician, I would have this in my office on the wall as a quick review of my piece and the things that I need to be responsible for in that room. And some other people might want to choose the guidelines that we gave you, and so we just wanted to make sure that you remember this and you have it. And engagement is so important to achieve the aims of the therapy. Can we have the elements, the tips put up, Tara? Okay, great. Thank you so much. And so this is really something that I would encourage everyone to print out before the webinar is over and just really see how, I like how you enlarged that. That's great. To really see how, this representation and the comments to it really do help to ensure that engagement is really something that the clinician focuses on in every level that they work with their participant. And it really does help to solidify the relationship. And my favorite part of all of this is the very end of it, where everyone deserves respect, everyone has strength, judgment can wait, it could be outside that door, and partners share power, and partnership is a process. And so it's just so important to have the respect for the participants' expertise, right? They are the expert in their own lives. They know what works for them and they know what doesn't, and sometimes they just need our support to help them engage in other behaviors that are healthier for them. When we have relationships with them, we help to build competency in their capacity to take over and make decisions for themselves. And of course, as we come to this work from a strength-based perspective, that automatically, to me, brings all this other stuff with it. If I'm sitting there and I totally respect the person across from me, I'm going to engage with that person. I'm going to respect them for their expertise. I will allow them to be heard. We'll be addressing barriers and be collaborative. And so we just wanted to review that with you one more time. Does anyone have any questions on this? Okay, thanks.
Thanks so much, Ruth. I just wanted to go over the engagement process really quickly again. I know you guys have seen the slide at every time we meet virtually, but just as a refresher, this is our foundation of thought, that we have phone-based engagement, we have in-person engagement. I think a lot of you are doing mostly in-person engagement these days with open access, but just as a reminder, the phone-based engagement, there's that first contact when somebody may first call the clinic for an appointment, or they may come in person. That very first contact is so crucial. Phone-based engagement can also look like ongoing, where, as Joseph had mentioned, he's now doing reminder phone calls, and I think so is Carrie, and so that ongoing phone contact is really important too. And then in-person engagement is the first meetings as well as the first contact, and then ongoing contact. And just as a reminder that every point of contact is an opportunity for engagement. And then the bottom layer are really some considerations for treatment and practices that you can utilize during these phases that may be most helpful. So for example, in the very first contact, motivational interviewing and trauma-informed care, you may really want to consider some of those practices in those very first contacts. And I think a lot of you are doing that. Also with your ongoing phone contact, thinking about trauma-informed care as well as your first meetings. That's something that we recommend you really utilize throughout treatment, no matter what phase you're in, but especially we put in the beginning so that it's a reminder. During the first meetings, you're going to think about discharge planning, and then which is also treatment planning. And then ongoing contact is you can think about the use of ropes and action steps. So just to remind everyone of the process and the 4 phases of the engagement process is that initial contact, the initial interview or meeting, the ongoing services and retention, and the terminating of services. And these guidelines that we created are for all of those various phases, but you can also think about them not in increments, but as an ongoing kind of continuum as well, if you'd like. So we just have a poll question for you. What phase, and we've asked this before, but I just want to check in again. What phase of engagement process has been the most challenging for your organization? The initial contact is A, the first interview or meeting is B, and the ongoing engagement is C. What phase is the most difficult? I do think it's helpful to think about the phases as a way to intervene. And I think a lot of you have done that. A lot of you have mentioned, you know, it's that after that first phone call or that first contact, then people normally don't show up, or they show up for the first few sessions and then they don't return. So if you can think about which phase you're most challenged with, that's when you can also start to think about applying some interventions or just little tweaks that you all are doing seem to make a really big difference. Just choose from the poll question A, B, or C, so we can just get a sense of how it's going for you. So for most of you, it's the ongoing engagement. Wonderful, wonderful. So the session feedback form seems to be a really wonderful intervention for ongoing engagement to make sure that you're aligning with the goals of the participant throughout each of the sessions, and also so that you're not kind of crisis-driven. A lot of our work with participants can be kind of crisis-driven, so some people call it COWS, Crisis of the Week. I know it's kind of a weird term, but if you're using that session feedback form and you have the treatment and discharge planning, then you're less likely to kind of be crisis-driven in the work. So just as a reminder. We're going to just review those engagement best practices to really decrease the no-show rate, which you all know is just, again, just a brief review.
Right. So some of the things that we want to do, again, and this speaks to that orientation group that Carrie mentioned that she was doing, is we want to help participants understand the cost-benefit analysis of being in treatment. So you want to give them as much information as possible in terms of what is treatment, you know, what's the length of treatment, what role will they play versus what will you do. You want to create that working alliance. So really, again, it opens the door in giving them, you know, voice and choice and the options that are available to them. We want to build a trusting relationship, right? So we need to establish trust by recognizing that historically there's been some power dynamics at play, and so we want to recognize the potential to be dismissive about that. And also, for some who have been maybe in treatment for some time and have, you know, gone around the block a few times, this may seem a little foreign to them, a little new to them. So as a therapist, we may have to just reinforce that we are really looking for them to provide us honest feedback about the services for us to figure out how we can better assist them. And again, that goes along with empowering them, right? Again, so I'm not necessarily that participants will be jumping at the bit to provide their feedback. They actually might be a little skeptical, a little nervous, not really sure what you're asking for. And so we just have to remember that, but we do want to encourage that over time. Next one. Treatment negotiation. I've talked a little bit about this in the past, and that, you know, sometimes things don't work for families as we envision. We may, you know, assess an individual or family and decide that, you know, we put together this great package of treatment services for them, only to find out that that is really not doable for the individual or family. And so there has to be some negotiation around that. So, you know, if I think therapy, you know, should be 12 weeks, but they can do 8 weeks, we need to find some fine line in terms of negotiating that and seeing if we could lightly prod them forward when they're at that kind of crossroads that we've determined. We want to provide support to the patient regarding difficult life circumstances, right, that may preclude participation in psychotherapy. So, you know, if they're homeless, if they're struggling to get their basic needs met, we can't just skip over that and do therapy as usual. We really need to attend to that and help them get those needs met. Appointment reminders are great things. Motivation enhancement, so initiate procedures that increase their willingness to enter and remain engaged in treatment, again, like that orientation session that was spoke of a little while ago. And the facilitation of therapeutic alliance. We want to foster a strong working relationship early in treatment, and we want to maintain awareness of the quality of the relationship throughout the therapy. So it's not good enough just to know that you have, you know, engaged them in the initial piece. We have to figure out how we do that on an ongoing basis.
Thank you, Yvette. I want everyone to unmute yourselves if you are muted, and let's just have a chat. What barriers and challenges have you experienced throughout the engagement process? And I know through the poll, a lot of people were talking about the ongoing engagement as really being the most challenging. Just wanted to know what specific challenges and barriers you've experienced. Come on, chime on in. I'm hearing a lot of beeping. People are unmuting themselves. That's great. You've obviously experienced challenges in the ongoing engagement, and I'd like for you to look at the guidelines for ongoing engagement. And I love, Joseph, what you said before about giving it to your staff, and that's wonderful. Does anyone have any specific challenge that you've experienced?
You know, I'll say something if you don't mind. This is Joseph again.
No, Joseph, that's great.
Okay, so one of the problems with the ongoing engagement is that when I first meet with somebody and we do an intake and we explore what services might benefit from them, we discuss things such as care coordination services, housing services, because a lot of our clients are homeless, and a lot of them have a lot of what's called psyche flags, you know, for medication adherence, and they're very, very on board and they're very interested in all those services, but they're also, they're very, they want things immediately, and after, you know, it seems like everything's a process, they get kind of upset about the fact that it's taking a lot of time. Even sometimes with care coordination services, we try to, people who would benefit from them, we try to engage people in care coordination services, and the process of getting them to enroll in those services, and by the time they get linked up with a care coordinator, it could be a long time, and they get discouraged. Housing is very, very difficult. People sometimes, you know, they get frustrated because they don't see any results coming about with the housing applications. And then the other thing is that their stability in terms of where they're living, and if they have a phone service. I mean, their phones are very, very difficult to maintain service with and getting in touch with them. So that really interferes with ongoing engagement.
Right. You know, you're bringing up such important information when people have these basic needs that they need met. That sort of takes priority in their life, you know, and sometimes the engagement with their clinician is not right there in the front of their minds. With these high needs individuals, they need to take care of what's important for them in that crisis moment. And sometimes I agree with you, Joseph, it seems like there's a lot of crisis all the time. And they want things and they want them now. And how has that affected their engagement with, their ongoing engagement with you and the clinicians that work with you?
Just, they become kind of disillusioned, and you try to help them with these services best you can, but they're more likely to miss sessions or reschedule or come in when it's convenient for them. And then the other issue is that a lot of them also attend substance abuse program, and they have rules, and they live at a residence that's a substance abuse residence, and there's rules regarding that. And sometimes that interferes because nobody corresponds with our mental health program in terms of what these other obligations are. And for the residential program, somebody may disappear from treatment, and we're not informed about that. We may not know about that until the next week when they don't show up for the session. And no matter how much that we address it with the residents, is how important it is to let us know if a client disappears. It's just we never seem to get that information. Yeah, we find out by accident.
Right. Or from someone else, right?
Or from someone else.
Yeah. In my head, because that was such a big problem, connecting with those other resources in the community and ensuring that information is passed along both ways. It can be really, really challenging. And I'm sure all the other people on this webinar are nodding their heads as well.
Yeah, I mean, we identify people as being of high risk, and we expect the residences to let us know what's going on, and we just don't get that cooperation. We need the residents to make sure that these people are here, are going to see the psychiatrist, and I do everything to try and expedite psychiatric evaluation as soon as possible, but we really depend on somebody helping to get these people here, and it's very difficult. And then the other issue with, there's a lot of things what's called three-quarter residents, which I have to tell you, I mean, to be honest with you, they couldn't care less about these people. It's about, somewhat collecting $215 a month, and the living conditions are deplorable. And I don't know if there's any oversight in terms of these three-quarter residents. But, the clients come in, they complain to us, to the therapist, help us, what can we do about it? And there's almost, I mean, I have this legal service who helps specifically with three-quarter residents, but again, everything's a process, and they're at a very desperate state.
Yeah, and on top of everything that your staff have to deal with and work on with the participant, it's almost difficult because they've got all these high needs and housing issues that really do take precedence. And then how do you do care management at the same time and try to help them with these basic needs? And we all know that's really critical. But some of this is ongoing. Does anyone else in the webinar experience something like this, that the outside interferes with the engagement process? Okay, I guess that's a no.
I just wanted to chime in, Ruth, if that's okay. Because, Joseph, I was wondering how things are going. I remember in our last webinar you had talked a little bit about this big challenge and barrier around the housing and the experiences in the housing kind of interfering with the treatment progress. You had shared an example of someone who was doing really well and then had gotten kind of kicked out of the housing and then was lost to contact, but had been doing really well, and you guys had been utilizing some real engagement techniques with them that was really helping to improve progress and treatment. One of the things we talked about was it seemed like a few things. It seemed like this was an opportunity for maybe the leaders, you and the leader of the housing, to kind of get together and brainstorm around ways that you could better serve the clients and participants that you're both seeing and you both have the best interest in mind for. So I was wondering if you were able to do something like that, or if you have other ideas.
Yes. Well, we have to an extent, but we don't get a lot of cooperation still. You know, we discuss. I mean, it's a case-to-case basis. We've had meetings though with the clinical staff at the particular residents in particular. I mean, nobody from three-quarter residents, you know, is interested in engaging, but there are two treatment residences that they have a clinical staff there, and we do cooperate them. But there's the bulk of our clients, and it's the most difficult, even when we do address it with the director of the outpatient substance abuse program and with myself. And basically, okay, we'll address this, and they are also being paid for to be the care coordinator of these people, so I can't even get them other care coordinators. And to be honest with you, I'm just going to say, no, all I get is I get yes to everything and nothing happens. So
that's really frustrating.
It gets very frustrating. So a lot of times it feels like we're all alone helping these people, and it's just getting very frustrating.
I hear that. And then there's also seems to be kind of an advocacy issue around the housing conditions of the three-quarters housing. So I don't know if you're connected to any kind of advocacy organizations that may be able to help you with that component as well.
Yeah, there's a legal agency. It's called MFY that, you know, from time to time a client comes in and has a problem, and I refer them to that agency. But basically it's like legal help and making sure they know what their rights are. But these three-quarter residents, I don't believe that they really adhere to all the rules, you know, like in terms of, you know, you're not allowed to evict somebody with a certain amount, unless you give them a certain amount of notice. You have to maintain a clean and safe environment. I mean, I had somebody today just come and show me pictures of a bathroom that was all rotted out, and that there's rats running around in the upstairs. And it's a very common complaint we get.
Well, I'm also wondering if you provide any kind of groups for people to air these grievances and figure out a way to kind of work together. Maybe if they're in the same location or something of that matter, that they can kind of get together and receive support from each other and maybe share some ideas. Are you able to implement something like that?
You know, in terms of the groups, the agency substance abuse program, the frustration about the housing situation comes up in their groups. We don't, right now at this time, we don't have any groups available at the mental health program because it's so difficult to get people to commit to come to a group. And no, we don't have anything like that. I mean, if we were to arrange for someone to come in from like a legal service agency and speak to people about that, that's probably something we could arrange. But at this point, we haven't done anything like that.
Yeah. Okay. Anybody else have any ideas for Joseph? or any thoughts? I mean, you know, when we're working with other systems, I worked in a residential treatment center for quite a while with kids, and having to coordinate with ACS and caregivers and education systems. And when you're working with multiple systems, it can be a real challenge, but it's also so important to work together for the sake of the participant, because they know when that's not happening. So any advice or any thoughts for Joseph here? Well, maybe we could talk offline some more about this, Joseph, and really brainstorm and be a support for you.
Okay, that would be helpful.
Okay, wonderful.
Great.
Okay.
So any other barriers, or should we move on? Okay, we'll move on. So we have 2 vignettes, but before we do that, I just want to check in on your improvement planning guide. So all of you chose some area of improvement. Most of you chose to focus on 1 or 2 clinicians and think about their engagement challenges and working directly with them. I'm wondering how that's going, if there's anything we can do to help. I want to let you know that we do have our web page for you. Brianna had posted that link where we're also going to post today's webinar, and all of our resources are there as well. But I'm also offering that we can set up individual calls with you if that would be helpful as well. So check in with us. Let us know how your improvement planning guide is going and the area of improvement that you've been working on. I know we've heard from some of you around the various tweaks and changes that you've made and the success around that, but are there other areas of improvement that you're working on that you'd like to share? Well, no. You can also chat in, or I can.
It's Terry.
Yes,
one of the things I think, like for us, in the area that I'm looking for improvement is, staff, and then really using the tools that's been provided for them. So for me, it's more being able to monitor that and having them be more involved in using the tools that are available. So that's kind of more of where I need to see improvement. Because even like to identify each staff and get the client, that was a little bit of a process. So it's really getting them on board and understanding like that engagement is really important. It's it's not just a process; it's really engagement in the process.
Yes.
Care.
And this is why we had recommended that all of your staff attend those engagement webinars, which it sounded like all of your staff did, and then you can kind of go from there around working with people individually.
Yeah.
Wonderful. Anybody else? Well, please let us know. You can email jason.jones, even though he's not with us today. He's still the coordinator of the project. And if you would like to set up an individual call with us, we'd be happy to do so and do some, more problem solving directly with you if that's helpful. I'm going to interpret the rest of the silence that you all are doing a wonderful job. So we're going to move on to just a few vignettes. The first one is around clinician resistance. Ruth, do you want to take this over?
Sure. So let's work on this vignette. Stephen is a mental health clinician with 13 years of experience working in an adult outpatient clinic in upstate New York. And so he's obviously a seasoned clinician. Over the past year, Stephen's participant no-show rate has steadily increased, specifically following the second and the third contact. So that's where we've got the ongoing engagement dropout. Many of his participants have also asked to work with another clinician, stating that he just doesn't understand them. So how should Stephen's supervisor address this issue with him? Any ideas? Got a 13-year seasoned clinician, and now when we're doing the productivity levels of each staff, we obviously see that his people are dropping out.
My first question would be, it's Carrie. My first question to Stephen would be, what does he think is impacting upon the clients not coming in on the second and third appointments? I'd want his perspective first.
Yeah, right. That's very good. and to get other people's perspective too, right? The participants themselves, he doesn't understand them. What does that mean? And what does he think about them, right?
Right.
That's a great idea. Good.
And as a supervisor, we might want to take a look at that and say, well, he was doing well up until this point, so maybe we might want to check in with our supervisee to say, hey, we're noticing this, how you doing? Are things going okay for you? So more like a concerned type of let's check in, because in looking at this could be attributed to many things. One, I can see probably being burnout, since he's probably seasoned, or there could be something impacting his personal life, which is impacting his ability to do the job. So we would definitely, as a supervisor, want to just tap in and say, hey, is everything going okay?
That's great. Thank you. Any other comments?
I like the suggestion around just checking in with the clinician around how he's doing. Is everything okay? This reminds me of our beginning conversation, and maybe having him begin to utilize a session feedback form might be helpful to get a sense of the feedback from the participants, because as somebody mentioned, he's communicating with his actions, right? He's not verbally communicating, or the participants aren't verbally communicating, but they're communicating by not returning to sessions. So I think it sounds like maybe just inserting some supportive resource such as a session feedback form could be really helpful here. So that's great. So let's move on to our second one, because I'm looking at the clock here. This is a common challenge called treatment negotiation, which Yvette had covered earlier. So we're going to just look at Rebecca. She's a 31-year-old participant who has struggled with anxiety for most of her life and has been attending your clinic for the past 3 weeks due to stress at work and the feeling that her life is falling apart. Rebecca missed our last session to attend the funeral of her mother, who passed away due to terminal cancer. Rebecca's therapist feels that the focus of the work has recently shifted, and she worries as Rebecca refuses to speak about her mother's death, stating that she knew that it was coming for a while. How would you continue working with Rebecca? So she seems pretty vulnerable right now. She's only been attending only three sessions for the past 3 weeks. She's 31, has a history of anxiety, it sounds like, and pretty vulnerable. She just lost her mom. How would you continue working with Rebecca? I'm bringing up the guidelines for ongoing contact just to remind us. So expressing empathy, validating, identifying strengths, building hope, and foster resilience. Rebecca may feel a lack of hope, just losing her mother, even though she knew that it was coming. It sounds like it's not something she really wants to talk about right now. And being with her wherever she is and how important that is. Any other thoughts? Problem solving around barriers. Are there any perceptual barriers going on? Are there any concrete barriers? Any other ideas? No, she may be really overwhelmed, so maybe one of those reminders. Yes.
It's Carrie.
Hi, Carrie.
I would just do do the empathy part and express the difficulties of losing a parent connected to the anxiety, and then offer other supports that are available to her should she choose to want to use these supports. and, you know, just be where she's at in the moment and validate the difficulties of discussing something that's so fresh and new. And then just provide what other supports can be there for her. And then it's an ongoing process, you know, of continuing to, you know, engage that area and following up and normalizing her experience.
Wonderful. Thank you. I really appreciate that. I think connecting it to the anxiety is really helpful as well. Maybe her mother's sickness was contributing to that anxiety for a while, and really just being with her where she is. I completely agree with your recommendations. Anybody else have any thoughts?
Carrie, to that, I just have a few thoughts around that. Again, I just want to reiterate, sometimes life has a way of kind of getting in the way of us kind of going along with our original plan. So I'd really love someone to just really think about revisiting the treatment plan, and is it still appropriate given all of the things that have just kind of unfolded. So, you know, and really to assess not just from an empathy piece in terms of that you lost your mother, but were there some practical challenges associated with that? We know that lots of times family members reside together, so is housing going to be impacted? You know, was the parent a source of financial and emotional support? So really just assessing that. So really, I think the time is to kind of go back to the drawing board to really figure out how are we going to help this individual move forward.
Great, because we don't want to lose her. She seemed to be engaged, and then now had this really big event in her life, and where I agree she probably does need a lot more support, but maybe doesn't want to process her feelings that she has. Those are some pretty big feelings. Thank you, everyone. This has been great. So we're going to wrap it up just to let you know of our upcoming CTAC events. Our next event is May 4th. That's our final webinar. We're going to ask some of you if you'd like to present during that webinar. I'm going to reach out to those of you who seem to be really utilizing the resources and making some changes. If you'd like to present just briefly for others to learn from you, I think that'd be wonderful. And then we're just going to send out a brief follow-up survey in June to see how it's going. And then I just want to look really briefly at this before we say goodbye, these performance indicators. If anybody has any to submit to us, please do. You absolutely don't have to, but it'd be helpful for us to see if anything has changed. I know, Joseph, you had been using this with one participant in particular that was doing really well, and then that's also, unfortunately, the same participant that stopped coming due to the housing situation. So if you have any kind of attendance or discontinuation to talk about with us, we'd love to see that, and as well as your improvement planning guide. But most importantly, thank you so much for participating with us. And if you'd like to do an individual call with us, we would be happy to work with you individually as well. And this is our contact information. And you could reach out to Jason Jones, would be the best person to reach to set this up. We also have our website where we're going to put today's recording up along with other resources. We thank you so much for your participation and really for all your hard work that you've been doing and the changes that you've made. You're doing a wonderful job, and we appreciate you sharing that with us. We hope you have a wonderful day, and we'll talk to you in May, if not before.
Thank you.
Bye, everyone. Thank you.
Bye-bye. Bye-bye.